If you or somebody you love is thinking about a breast lift, this video will show you a patient who goes through the whole thing. My name is Dr. Anthony Youn, America's holistic plastic surgeon, and I help health-conscious men and women look their best by teaching them a holistic approach to beauty. And today I'm going to show you a patient before, during, and after a breast lift surgery. So here's our patient today. She's a 35-year-old woman who dislikes the droopiness of her breasts. The other thing is she's got breasts that are two different sizes. Her left breast is larger than the right. Her left breast is on your right. And so we're going to reduce the size of her left breast and we're going to lift both of them. So let's head into the operating room and I'll show you her markings. All right, let's take a look at her markings. So we covered up the nipples. Nipples are going to move up here and here on both sides. I'm going to remove all the skin otherwise, so we are going to leave it with the scar round, down, and underneath. I'm going to take a little bit of tissue off of this side because this side's a little bigger starting out than the other. And I'll show you how she looks when we're all done. All right, we're all done. She did very, very well, and you can see she's nice and lifted. We took a little bit of size off on her left, your right, to try to match them up nicely. You can see where the scars are. Now it's going to take a few months for everything to settle, but I think she's going to have a real nice result. All right, we are a month and a half out of her surgery, and she's healing beautifully, very lifted and looks good. You can see here on this side, there's a little bit of flattening on the bottom of this breast, which is very normal at 6 weeks out. That's going to round itself out as time goes on, and it's just the type of lift that we do starts out that way. Her other side, you can see, however, is rounding out nicely already. The shape is really turning out very, very well. She does have the scars, and those scars are healing really well, and she's back to completely normal activity now. So just 6 weeks out, still healing, still a little swollen. Things are going to continue to improve, but she's on the right track. So she is doing really well. I'd like to give you a few tips on breast lift surgery if you're considering having it done. First thing, and the most important thing, is you have to be okay with the scars. Typically the scars extend all the way around the areola, vertically down, and to an extent underneath the breast. These scars are permanent, they never ever go away, and there's always a risk of thickening of the scars. So even if you've got the best plastic surgeon in the world, even if you're using scar creams twice a day, every single day, you can still end up with scars that don't look so good. So keep that in mind. The main risk of the surgery, or a big risk, is the fact that those scars may not heal the way you want them to. Second thing is that there are a lot of different types of lifts out there, and I have tried most of them, and some of them don't work that well. The main lift that I want you to keep in mind to avoid is the donut breast lift. There are some doctors who try to convince you that by doing a lift with a scar just around the areola, that they will limit the scars, yet you'll still get a nice lift. And in general, that is completely not true. The donut breast lift is a rob Peter to pay Paul type of thing. And because you limit the scar to just a circular scar around the areola, that areola then can widen, and it can go from nice and small to literally this big, and I have seen it in patients. So be wary of the donut breast lift. Well, I hope this has been helpful for you. More great videos right here.